So thank you everybody for joining. Delighted to introduce you to Gill Phillips from the Who's Shoes phenomenon, and I will hand you over for Gill to begin. Thank you very much.
Okay, so I'm absolutely delighted to be here today working with Fab Change Day, and hopefully our session will be so we use social media a lot, as some of you might know if you follow me at Who's Shoes on Twitter, which is, I guess, how I've got involved in all of this over the years. So as I say, welcome. And this screen we use a lot to start our virtual Who's Shoes sessions. Unfortunately, I don't think I can get you actively colouring it today because it's not quite so interactive as some of the sessions on Zoom can be, because obviously it's part of a much bigger webinar format. So here's one we made earlier. It's not the same as you being there, but that was co-production live at CoPro Live 2 days ago on Monday. So we've had a big week. And CoPro Live is a 3-day festival going on at the moment in anticipation of launching the UCL Co-Production Centre in London tomorrow. So you could get involved in that in the afternoon tomorrow, their launch event. So a big shout out to Anna and Carrie. I don't know if either of them are on the call. I suspect Anna is, because I've seen Anna's iPad. I don't know if people are allowed to. I think you can show yourselves on the camera if you want to. So anyway, Anna and Carrie are our fabulous graphic artists that we've worked with for many years. And when we do Who's Shoes events, they typically record the conversations in the room. And we looked at how we were going to work together to take our offer online at the beginning of the pandemic. So that's really the story today to some extent, the work that we've done together, learning from COVID and building our virtual Who's Shoes offer. So a lot of the images that you'll see today will be produced by these wonderful people, and obviously a huge acknowledgement to them. So this is me. What do I do? Well, I jumped ship from my day job 12 years ago to set up Who's Shoes because it just seemed obvious to me that the whole of kind of health and social care and services, and my background was in social care, and I became passionate about personalisation, but it was all about people, and managed to create this tool that brings people together, people of all ages, people from different backgrounds. In the top middle picture there, the oldest person who's ever taken part in a Who's Shoes workshop was 101. In one of the middle pictures at the bottom, the youngest participant, as far as I know, was 4 days old, and that this baby was definitely 4 days old. And I don't suppose we've ever had one younger than that, because that's going something really to get yourself to Who's Shoes workshop with a 4-day-old baby. But what we try and do is inclusive and hopefully fun, and to create the conditions for people to have real conversations and to have true co-production. So that's me. If anybody has been told that Who's Shoes events always have extraordinary cakes, then I'm really sorry. That's one of the few things that we really haven't managed to do yet online. Obviously you can bring your own, but it's not quite the same. We try and make our presentations topical, and this was something that somebody tweeted on the 7th of October, just as we started our maternity event with working with Shrewsbury and Telford maternity team. And I think it's just as relevant for today and every day, really. Anything is possible when you have the right people there to support you, and you can make a bit of magic yourselves. So what is Who's Shoes, and why am I in this sector, in this session rather, in this black column today? Because I think what we do is working across, I wouldn't call them sectors, but some people do. I call them community, and obviously the NHS and social care, but people don't exist, they don't live in those silos. We're all just people together, and I think the pandemic has shown us that more than anything. So I've got a bit of previous with Fab Change Day, so I thought just to give me some credentials on the day, I could perhaps just give you a quick whiz through some of the things that we've done over the years. So back in 2015, can you believe, that's 5 years ago now, the work that we'd done, I don't know if people know the Matt X hashtag. I've got my necklace today, MatX, maternity experience. It's a hashtag that's had way over 1 billion Twitter impressions. We're not able to count them anymore. And that was 2 or 3 years ago, we got to 1 billion. And because we were making a lot of noise in maternity care, and we're feeding into the Better Births national agenda, and Florence Wilcock, who's pictured there in a rather awkward lithotomy position, consultant obstetrician at Kingston Hospital, was my partner in crime, basically bringing Who's Shoes into the maternity service. We ended up having a bizarre day at Kingston Hospital, running a live Who's Shoes workshop in the antenatal clinic, and with Helen Bevan and the Fab Change team coming and filming poor Flo as she started off what has become a very famous and influential challenge called the Lithotomy Challenge. If you Google the Lithotomy Challenge, you'll find some very interesting pictures. You'll find a lot of pictures of people. Luckily for them, they're fully dressed, whereas mothers giving birth obviously aren't. And a lot of them are men. So finding out what it's like to put your feet up in stirrups and have people wander in and out of the room, possibly with a film crew. All of this is just an example really of something that you can have a little bit of fun, but to get across something that's really serious and to make people think about patient experience. So also in the same year, I think this probably counts as my 15 minutes of fame, we got interviewed. We were talking about the different Fab Change Day campaigns at Skipton House, and Simon Stevens came and asked me about it, and I knew I hadn't got very long. And one of my friends was saying in my ear, Gill, less is more. So I was trying to talk to him about language and how important it is. And I ended up asking him how he'd feel if someone told him that he'd failed to dilate. And well, it's another story what happened, but he took it very well and told me it would be a gynecological miracle for a start. But the work that we do tries to get people really thinking about language, failure, all sorts of language that's used in healthcare that probably nobody means badly about, but it can affect people very badly, not just in terms of perhaps being offended or made to feel a bit rubbish, but also patient safety. So it's a big part of our work, bringing patient experience and patient safety together. So these things don't go away. You know, MatX is a very vibrant challenge, and only this weekend, Anna was tweeting this rather graphic picture of how our bodies respond to labour. So the 1 centimetre, 2 centimetres, up to 10 centimetres mouths. I think a lot of women in the session might relate to that quite a lot. So, okay, moving on to 2016, we were left off the map. We were left off the Fab Change Day map. There seemed to be events or big things going on in other parts of the country. So I know some amazing people locally to me in Coventry, people like Grapevine. They do fantastic community work. So we decided to put Coventry on the map big time with Covmind the Gap, which was looking at the gap between people and what matters to them, and services and what's typically provided, and possibly all in silos. And we had the most amazing workshop, very colourful, very lively, the apparently hard to reach people queuing up at the door to come in. And we went on and did a magic mile walk in Coventry with the sun shining in October, storytelling in the old cathedral, singing outside the council house, but that's another story. And there are videos. If you look on my YouTube channel, you can see the fantastic community-based or community-led, I should say, story of Covmind the Gap. So 2017, I don't know whether people might recognise Helen Bevan there and Neil Churchill. I was keen to launch our Dump the Daft Words campaign. So again, picking up on this passion for improving language. Now, as you can imagine, lots of stories sit behind all of these slides. Most of them are somewhere on the internet. I use a lot of Stella stories, and you can find out more if you're interested, but I haven't really got time to tell the stories today, just to give you an idea of my involvement in Fab Change Day. So as part of that, we launched the negativity bingo, as you do. So I think within 2 hours, 3 hours at the most on Twitter, put this out. Hey, you know, what do we think is negative language in maternity care? And obviously, you don't have to agree with all of those things written on all of those squares. So it's like whose shoes, the scenarios, you're not looking to agree with everything. You're looking for it to be a conversation starter and to recognize that somebody had been upset by that or has got a story behind it. So the negativity bingo was in that year too. And then, as I say, really language and how it links to safety. And I've got Stephanie on the call, who I'm going to hopefully bring in later, telling us a bit more about the fantastic Patient Safety Learning Hub and how we've linked up together as a direct result, really, of this series. So I thought just to put in a little clip of how Whose Shoes works in the room. I mean, it seems a long time ago, doesn't it now, where we could all get together safely, and the kind of what we used to do, and the fun and the energy and the cake, and how we have tried to convert that and take that online, appreciating that you can't do everything that you could do, but sometimes you can add some extra elements along the way. So that's been our challenge really over this strange year of 2020.
And I thought these shoes just don't suit me. Hey.
Whose Shoes is a tool, possibly cool, simple yet challenging, relaxed and fun, gets people talking, gets things done. Crucial conversations for change, real change, all welcome, all equal. People, not roles, real scenarios, set your own goals, light your own fires, locally, vocally, take ownership.
I'm rubbing my eyes and I felt like there were 2 days missing as I focused on the time. Then I made my way to the kitchen, but I had to stop from the shock of what I found. A room full of all of my friends, all dancing round and round. And I thought, hello, new shoes, bye-bye blues. Hey, I put some new shoes on.
Round of applause!
Short on money, but long on time. Slowly in the sweet sunshine, and I'm running late.
So as you can see, that was a clip from Princess Alexandra Hospital in Harlow, and Shahid reading that poem that we use. We use poems a lot in Whose Shoes, and we gather the best ideas. We get people making pledges, we tap into their individual passions, and we get them the best ideas collated into lemon light bulb moments, stories, things to share, practical things. So you can see the synergy, hopefully, with Fab Change Day and why I like working with them. We have had 3 opportunities, 3 different maternity projects, which is the most kind of formal work we've done, if you like, where we've worked with NHS England and London Clinical Network and people like that, and have put the best examples of things that have come from our workshops into actual printed case studies. And the case studies are all available online. So hopefully we'll get the opportunity to drop those into the chat. And if they're not on the Fab Change Day website, then we'll make sure that they are. So, okay, so here was the big challenge. How were we possibly going to take all this online? And our graphic artists led the way really with this. Anna said, hey, Gill, do you think we could use Zoom to get people in the room during the pandemic? Carry on the Whose Shoes conversations despite our physical separation? Find out what's working, share best practice, what we want to keep, share it around. Should we get this off the ground? And I said, I don't know, but let's give it a go. Let's try JFDI. So JFDI is our Just Do It approach, which has basically been running through all of our work for many years. So our original idea was quite small. We had 2 aims really. One was to see how we could develop virtual Whose Shoes supported by our wonderful graphic artists, whether we could do it live. And also, I'm like a squirrel really. in terms of how I research Who's Shoes and all the scenarios that are written from real people's perspectives, I could see the fantastic sort of JFDI approach to the pandemic that was being taken by people in the community, by people in the NHS. And the original idea was to run one session and to showcase that best practice. But of course, things don't work out according to your plan necessarily, because that became too simplistic. And a far more intensive program emerged as we started to think about, but what about this group? What about that group? How does the pandemic affect them? How can we find good practice and share it to support these people? And I've got a little film later on that tells you a bit more about this. So I won't go into more detail of that program, but basically we ended up having one session a week for 6 weeks coming up to the summer holidays. So it's back in June and July. Really intensive, working with different people, finding out what their key issues were, what was working well and how we could help them. And that's really the story for today. So these graphic images, as I say, by New Possibilities, sum it up in a way. Informal networks can unlock our potential. See me, the person, not the label, not the diagnosis, not the condition, but me as a whole person. And let's create the space to have conversations to see how things can join up better for people. So we try and bring in a bit of fun. We haven't got cake, but we have had music. We've had hats, so people join the sessions, and when they want to speak, rather than raising an electronic hand, they put on some really quite colourful hats. So I'm just going to give you, or try to give you, a taste of what we've done in terms of these sessions that we've run over the summer, how we've brought the board game itself online. I'm just going to show a little bit of that at the beginning, but you'll get the idea, but more so about the types of scenarios and poems that we've crowdsourced to try and share best practice. So you should have the board game just starting now. We've got perhaps 4 teams. So if we're playing in the room or online, we might have 4 teams, and someone throws the dice and a little shoe moves, and they've landed on a blue footprint, so they pick up that coloured card. So blue cards are typically sourced by the people themselves. So this card, now we had people introducing their own scenarios. We had people sending us audios and using the audios to bring the scenario alive online. So more comfortable. I worry about my daughter working long hours in the NHS, and all the more so now she's been moved to the COVID ward. She told me the backs of her ears were getting sore from wearing a mask, and I started making lots of simple headbands with buttons for the elastic. Doing something so practical to help her and her colleagues distracted me from worrying. And it was lovely when they sent me some photos of them wearing the masks. So we were able to bring in photos to bring that scenario alive. We were able to bring in the person who'd done that. We were able to ask somebody whether they'd done anything similar to spread good practice between hospitals. So that's a community-based scenario, someone, genuine person, her daughter works in a COVID ward, and rather than just being a shielded older person at home, she's able to actually do something practical, and then to get the lovely photos coming back from the team and seeing her daughter and her friends, and it all becomes more human. So back to the board game. Okay, so we've got fast forward to Poets Corner. Now we use poems a lot in Who's Shoes, we always have done, and we crowdsourced some brand new scenarios to use during the pandemic and to get people thinking about all sorts of different things. So clapping our heroes, I'm sure we all did that.
Clapping our heroes. Hooray for doctors and nurses who save lives every day.
And other healthcare professionals and care staff, hooray.
And of course receptionists, porters and cleaners, those who deliver PPE to keep safe distance between us.
Oh yes, and those who make the PPE, sewing, 3D printing, often for free, fighting a difficult catch-up race.
And those who design it in the first place.
Pharmacists, dishing out essential meds,
manufacturers supplying new hospital beds,
supermarket workers, delivery drivers, people wiping down trolleys to kill the virus,
supply chain people we never understood, not least the farmers growing the food,
people putting pasta back on the shelves, rationing the loo rolls we can't share amongst ourselves.
teachers, bin men, transport workers are suddenly heroes, no longer shirkers.
Volunteers coming forward everywhere, helping in communities, showing they care.
We think before we dial 999.
That stubbed toe is probably just fine.
We suddenly value people much more, thanking those who bring food to our door.
Starting to see our strong interdependence. Time to stop fighting and encourage acceptance.
So a bit of a moment in time. Shops, the shelves are empty. We're suddenly grateful for all sorts of people. And the whole ethos of clapping heroes and gratitude and people, and how actually things are a lot more complex than perhaps we think they are. But how did it feel to be an NHS hero?
Ordinary people. Just ordinary people, don't you see? Daughter, sister, wife, mother, that's me. Caring for people every day. Profession, vocation, call it what you may. Taken for granted for so many years. Sweat, toil, heartache and tears. Long hours at work for decades. Suddenly valued and seen for what we bring to society, the benefits apparent this spring. Skeptics among us know it won't last. Already so quickly we're slipping back into the past. Don't let's become invisible once more. Stand up for us, with us, once and for all. Remember the heroes that carried you through are ordinary people like me and you.
So that poem, as you can see, was written by Florence Wilcock. Florence, I think I've already mentioned, consultant obstetrician at Kingston Hospital and very much my partner in crime in MatX. But hearing her read that now makes me quite sad, because she is a little bit cynical. She's worked in the NHS for a long time, and she wasn't a huge fan of the clapping. And, you know, I think we all need to ask ourselves where we are now and whether we still value the NHS and all these other people as much as we did, and how we're going to hang on to these beneficial changes. So I don't think we can do this just at the moment. I was hoping to do an interactive, get people to write on the whiteboard in terms of how this is all resonating with them, but you can keep your comments coming in the chat, please. So as I say, poems have been a very big part of what we do. We've got all sorts of who's shoes scenarios around all sorts of different topics. But the idea really is to bring everybody together. And as we developed our virtual workshops, it was amazing, really. We used our customer base and our social media networks to invite people, and all the 6 sessions were quickly oversubscribed. And we were amazed at how quickly we could bring together a diverse audience of clinicians and formal leaders. So in whose shoes terms, the formal leaders would be the people in red. So it's colour coded, the NHS chief executives, NHS England and Improvement, researchers, people like that. But we also brought in a whole range of clinicians, the general public, parents, people from charities, volunteers, my neighbour Trevor, who's I think just joined the call, which is really nice to see. And this is it, it's about people and people connecting. So, okay, so we did sessions around different topics, and session 2 was, well, okay, what about people who need the NHS but haven't got COVID? It's not COVID related. And we've explored and researched some scenarios for them.
Rewarding. I normally work as a pilot, and I also do regular work as a volunteer emergency responder for London Ambulance Service. As I can't currently do my day job, as most planes are grounded, I've been volunteering almost full time. As someone who grew up in London, to be able to help out on the ground, treating people, sometimes when they're at their most vulnerable, and being able to just help them and offer that reassurance at their greatest time of need is so rewarding.
So for me, and I'm sure for you, Cornelius Wilson's a hero. And I didn't know, and this was, the kind of scenario that I was absolutely loving collecting. Cornelius, normally flying planes out of Heathrow, he became a London ambulance driver and medical training as well. And his friend, who was also somebody that we heard about, who played, I think, can't remember which instrument it was, in the London Symphony Orchestra. And I've done 3 separate projects with London Ambulance. I'm really proud to have done that because they're very innovative and they're really keen to listen. And we've done a project around maternity care. We've done a project around mental health support, obviously all emergency services related, and also end of life care. So Sarah Fonteris, who's joined 1 or 2 of our sessions over the summer, was sending me examples of what London Ambulance were doing. And I just feel that people need to know these stories that go beyond the headlines in the papers. So well done, Cornelius. So this is another poem. Now, this poem was directly inspired by a friend of mine who, whose husband had sadly had heart problems, significant heart problems during the pandemic. And we were chatting away on the phone. And I suppose just in terms of my whole passion for messaging and how it comes across to people rather than the people who write the message, this idea that if you get through to perhaps the GP or to 111 and you get told something like, if your call is urgent, and we wrote this poem.
If your call is urgent, well, it's urgent to me. I don't phone the doctor normally. Perhaps I'm making a fuss and shouldn't be calling the GP. Messaging is so important, and the importance of getting it right when people are scared. They will hear the same words but bathed in a negative light. The message on the answering machine sounds straightforward to you, designed for what you call screening, but telling me I should not be phoning. That my medical problem is moaning, quite a different meaning. A lot of people are self-isolating and will hear your message alone. Please think of them and what they will experience when you leave a message on your phone.
So as I said, the whole point of Whose Shoes really is to get people actually talking together, to discuss that scenario, to discuss that poem and see what they can do about it, and to encourage people perhaps to look at their answer phone messages, to look at, we've done some tremendous work around letters that are sent out from hospitals, and to get people who've been the recipients of those letters writing them with them in terms of how it felt, and some really quite tremendous outcomes in terms of less did not attend type appointments, and more people actually going along because they feel that their anxiety or their concerns or whatever it might be have been listened to, and it's a more human letter and a more human approach, perhaps even with a follow-up phone call. So as these sessions developed and we got more confident with them, it was really good to see people smiling online, and that had been one of the main objectives. And as part of what we did, as I say, we worked with our graphic illustrators, and in addition to the, if you like, normal graphics that we produce, which capture the conversations live during the session and provide people with an ongoing record of the conversation, a way of keeping those conversations alive and referring back to what their people said about their service or whatever the topic of the discussion was. Because we had the benefit of having both our lovely graphic facilitators working with us throughout the series, we also realised how important it was to be monitoring what was happening in the chat so that people could have a voice either live through the sessions or through the chat facility. But the graphic artists couldn't hear those conversations as they listened to the live conversation and did the graphic record. So we also developed with the second person, so Carrie Lewis, doing a learning synthesis after the event, picking up really all the conversations from the whole session, but also reflecting on what this was meaning. And it turned into a very powerful, I think, metaphorical series of images around bridging the gaps between people and building the future. So session 3 was extraordinary, really. I'm so grateful to the people who worked with us to develop this important session and make it authentic. And people like Benash Nazmeen and also my friend Zainab worked with us to develop session 3 of our series, which was around people from Black and ethnic minority communities who, as we know, are all too often disproportionately affected by the pandemic and by other things. So this was, I've selected this scenario out of, we probably had 8 scenarios in each session. So this is obviously very kind of just high level and just picking out bits and pieces, but try and give you a flavour. Simply brilliant. I will always be grateful to Dr. Rachel Grimaldi, an NHS anaesthetist, who realised how difficult it was for staff to communicate with patients when wearing PPE, and invented Card Medic, which gives clear information to all and translates into many languages. My mum does not speak good English, particularly when she's distressed or in pain, but her doctor helped her by using these simple digital flashcards to find out how to make her more comfortable. Now we've got Steph on the call today from Patient Safety Learning Hub, and Steph and that team were the people who brought this to my awareness. And what shocked me was when on this call, which had quite a lot of people on it, this was our session 3 call, something as simple and as just do it as this lovely anaesthetist jumping into action and crowdsourcing all these messages in different languages. Nobody on that call had heard about it. So I guess this is my passion. How do you link people who are crying out for certain resources, certain services, you know, the so-called signposting, navigation in health, pathways, and other people who are doing something amazing, that how do you get those messages out more quickly? So Steph, were you able to tell us a bit more?
Yeah, can you hear me?
Yes, we can.
Oh, good, excellent. I can't do my video for some reason, but I think you can just hear my audio, but that's fine. Hello, everyone. I'm Steph. I'm the Content and Engagement Manager. I work for Patient Safety Learning. We're quite a new charity, but we're trying to make lots of waves at the moment. And so we have, as part of our strategy, we look a lot about, we look a lot at sharing learning, as Gill's been saying, and kind of trying to get these examples like the Card Medic example, and using our Patient Safety Hub, which is a platform, an online platform that anyone can join. And we're trying to use that to share these examples more widely throughout the world, really. And we helped Rachel with that, Rachel Grimaldi, who did the Card Medic example. We helped her with that in the last sort of 6 months to try and get that out there with some of the colleagues we knew across the water in America as well. And she's done amazingly well. It's such an incredible tool, you know, and such an important part of patient safety, because so many people were unable to hear their doctors trying to inform them, and their doctors were unable to ask questions because of these barriers of the PPE equipment. So it's such an important area, because if you can't hear your patient and they can't hear you, then it's pretty hard to keep them safe. So yeah, now this app is it's developing hugely, and they're looking at more accessibility options for it to make it as accessible as possible for lots and lots of different areas of healthcare. And I think it's now in over 120 countries, which is just amazing. And it's just such a good example of what we're trying to use the hub to do in terms of getting these examples and sharing it and promoting it, which, you know, it's similar to the Fab Change website and the Fab Stuff stories that are on there. It's the idea of taking these you know, ideas that come from patients or collaboratively or clinicians, and really making sure that the benefits are spread as wide as possible, and for us particularly for patient safety. So that's where we're coming from with it. And obviously we're always looking for examples of good practice, and on the hub you can go and you can start conversations with other people, so you don't have to kind of have a preformed idea, you can kind of bounce off people. So what you were saying, Gill, about, you know, how do we find these ideas? I think some of it is about finding those places to collaborate as well, and bounce ideas off one another, because that's how the best ideas get shaped, I suppose.
Yeah, and the networking as well, you know, through the research that I did building the series and attending webinars and bits and pieces all over the place. There's so much learning that's out there. And I attended a webinar that involved Helen Hughes, the Chief Executive of Patient Safety Learning, and also Claire Cox, who I knew from being a Darcy Fellow in the past. And that's led to a collaboration between us. And then I hear about people like Rachel, and then Rachel's contacted me today and said, let's, you know, talk about how we can share it more and so on. And this is the kind of networking, I think, the informal structures that I'm so interested in, as well as the more formal structures. So thank you very much, Steph. That was brilliant. Nice to hear a different voice, because normally I do loads of stuff with people, not just rabbiting on my own. So that there we are, there's your patient safety hub. And we already have done a collaborative virtual event together, looking at how patient experience and how staff safety and patient safety are really two sides of the same coin. And we did that together for World Patient Safety Day. So again, there's a video around that you could find. So as I say, these extraordinary images were coming from all of our events. So this was the session 3. And quite quickly, we were finding that the term BAME wasn't something that people really identified with. So that's why it was crossed out there. And that's listening to people and realizing that people don't want to be lumped together under one great big label because it might suit other people, but to actually get to know people individually and culturally, and to realize that different cultures have very different ways of doing things, which obviously we all know, but to kind of stop and think about it sometimes, and think about how some of these things pan out. So that was the visual that was captured live during our session. And then in terms of this learning synthesis idea, these are just some little extracts taken from the equivalent image that Carrie Lewis did afterwards. And some of these images can become so iconic. And I'm sure you've seen this before. We're all weathering the same storm, but we're in very different boats. And that's what we're trying to get people to think about. So this obviously goes back to In the Room, Whose Shoes events, a little collage of photos of people making pledges. And this is a really important part of what we do. We try and sow the seed that not just stuff should happen, but actually, what about you? What about, you know, what is it that you individually are passionate about, and what can you do about it? And it is lovely to see. I mean, what really makes my heart sing, if you like, is to see someone who's never had a microphone in their life just jump up and tell people what they're going to do, or be able to connect them across the country with somebody who's already done it, or somebody who's working in the same area. And that way, not only does more happen, but friendships and communities and you know, humanity, I think, builds from that. So our challenge became, well, can we do the same kind of thing online? Is it realistic to get people to make pledges? You know, people put things in the chat and so on. So at this session 3, we were trying to add different aspects each week, both technically and also in terms of pushing the boundaries of what we were doing. And we started to get the idea of filling grids live as part of the Zoom session. Zoom's got incredible functionality, really. And sometimes it's hard to actually write directly onto a grid. But then in this case, we got people also to write in the chat and put some of the ideas into this grid afterwards. And our idea here was that we were hearing from the Black and ethnic minority people that we were working with about microaggressions. So little things that we all might do, either deliberately, it could be, or completely unaware that particular remark or that way of handling things might upset people or cause offence. And because we were trying to do a positive series about sharing good practice, we worked together to turn that round into what we called micro first step support. So we got people suggesting ideas about what they were actually going to do if certain situations occurred, so that they weren't just standing back and watching, but that they were prepared to push themselves. And obviously it's about people's comfort zones and what people are able to do, but practical ideas that people had signed up to as to how they were going to behave differently. So some of the things that I'm including today, so for example, this lovely little clip here didn't happen immediately as part of the session. They've been ripples that have happened afterwards. So because we've been able to develop virtual Who Shoes, we've been able to carry on our work. And we did a really powerful workshop a couple of weeks ago, big online session with the Shrewsbury and Telford maternity team. And Jackie Dunkley Bent, who's lovely, and she's the Chief Midwifery Officer for England, very kindly joined us at the beginning of the day to introduce the event. And the subject of the event was continuity of carer. Really, really important national concept in maternity and very linked with the safety of mothers and babies. But what absolutely blew me away was that, as well as doing the kind of inspirational introduction that you perhaps expect, Jackie very generously shared with us and has given us permission to carry on sharing a poem that she wrote herself about continuity of carer. So over to Jackie.
Jackie Dunkley Bent, Chief Midwifery Officer for the NHS in England. It's a treat for me to address you, and I'll be finished by reading you this sonnet. And it is a poem, so forgive me if I pause in the wrong places. It's something that I wrote 3 years ago, and it's about continuity of care. It's a culmination of fear, concern from women and their families who haven't had that continued support from midwives, or who thought they were going to have continued support and then something happened and didn't. So it's a culmination of complaints that I have received over the last 2 decades from women, and it culminates in this sonnet here. A woman's cry for her midwife. I conceived and grew my baby, a new life, a reflection of me. But birth, the birth by me, how can that be? When I see myself, I am not free. Surely even I can give birth to my baby too. This is one thing even I can do. Yet the waves of doubt, will they pull me under? Oh, I do wonder. And then the midwife, my midwife, nurtures me. I start to share and feel believed. Each visit, and not to mention each precious call, bit by bit I feel reborn. My fear released, anxiety beneath, hidden memories I reveal. The waves of doubt won't pull me under, oh, but I do wonder. My baby grows, not so long to go. His head, I think, is nice and low, but the waves of doubt, will they pull me under? Oh, how I still do wonder. And then my midwife, just in time, our plans for birth now combined. My fear released, my strength renewed, my path is straight, no more reviews. The waves of doubt won't pull me under, and no, 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 I now don't wonder. My next appointment, diary in hand, so keen to share my heartfelt plans, empowered, believed, and no real fright, my birthing plans, at last no fight. And then the doubt comes creeping in, as my midwife no longer is. My disappointment I can't hide, and the waves of doubt firmly reside. Without my midwife by my side, the waves of doubt now occupy my every thought, both day and night. My hopes for birth now far away. How can I lose one and gain another? My trust I gave to that significant other. I shared my story one to another, and now alone I can't recover. The waves of doubt have pulled me under, and I no longer wonder. Where do I start? How do I begin? My story now remains within. You, new midwife, friendly enough, you can never know my stuff. I want my midwife and not you. I can't say this, if only you knew. I see a midwife and then another. I see a doctor and then another. I close down. I won't recover. They can't see. I am bothered. I don't connect. I cannot see. The waves of doubt, they have altered me. The labour happened. The birth took place. I remained in that dark place. They never saw, they never knew. The waves of doubt, my trauma grew. A birth not mine, pain untold. Where's my midwife? Do you know? The one I had, no alliance grew. Who that was, I never knew. Did you? Today I think what could have been had my midwife remained with me. But now I keep my hidden pain deep inside. It still remains. Yes, my story is untold. The enemy, depression, takes strong hold. Thank you.
So incredibly powerful, and things like a birth not mine, and the idea of a mum being kind of pulled down by the system. So something as apparently obvious like continuity of care, we all want to be telling our story once rather than lots of times, but it's more subtle than that, and it depends on individuals and clicking with people and having someone that's going to support you. So again, normally we'd have an opportunity to discuss that. We've had in one of our sessions we had a woman from Cornwall reading a fantastic home birth poem, something that everybody could have an opinion on, and we went into a breakout room for 20 minutes to discuss that, and then came back in terms of what people want to, you know, to bring forward and perhaps do something about, or report about what they've perhaps not thought about before. So as I say, we did this workshop a couple of weeks ago with the Shrewsbury maternity team, and this was one of the digital images that Anna and Carrie produced as a result of it. And bringing in, and well, I've included this today in terms of perhaps a bit more creativity. We had 6 breakout rooms, and I've got a thing about death by feedback, and we hadn't ever really had people reporting back from the breakout rooms before, but this was a more formal, longer all-day session actually, and we challenged people to do a 2-minute presentation about what they've been talking about in their breakout rooms, and to have prepared something creative, something visual to help them feedback. And I couldn't believe it. If you look in the middle of that image, I don't know if we can zoom in on that, but somebody in the group who was actually called Charlotte, I don't think they've realised the significance, had actually produced the Charlotte's Web. And people have got so many skills that, you know, if we find more creative ways of bringing people together and discussing and sharing, then it becomes fun as well as hopefully learning and taking things forward. So I think now we move on to session 4. Now session 4 was extraordinary. Session 4 was a ridiculously wide remit. We'd said, well, what about people who are just generally struggling during the pandemic? And we realized it could be people with dementia, or perhaps people with learning disabilities, or people with mental health problems, or people who were shielding, or people who just weren't coping very well with things. And we realized basically it was pretty much anybody and all of us. So the session turned into a more creative, fun session. And as we did the session, we were also planning for the following week. I promised to put a presentation into Brian Dolan's Global Health Summit around MPJ paralysis, which I think is just amazing. So we got a kind of double-edged aim, if you like, of feeding something into Brian's summit. So I thought it's just the best way of telling the story. So let's just see what we did for that.
Hello, my name is Gill Phillips. and I'm delighted to be with you today, sharing a bit of our work that we've been doing as a result of the pandemic. Well, that's fair enough, isn't it? You can't say that you weren't warned.
Safe. So safe. Safe in my chair, I sit and stare. They only seem to care if I move. Walking around, I might fall to the ground. So I sit in the same old groove. And I watch TV, obediently. But what if the TV blows up?
So that was a poem that we used at our virtual Whose Shoes event last Friday. I'll tell you more about Whose Shoes as we go along. It got people talking. It sparked a really interesting discussion. People started thinking about risk, about personal choice, mental health, and how different experiences affect people differently. These are just some of the comments from our chat box.
But it's kind of more of a routine exercise to keep people just thinking differently about how they move and the importance of movement. But for me, I think having cared for my grandparents, it's also understanding how we make it fun and not just like a boring, dull exercise, that people don't really want to do. And I know particularly through my work with older people and caring for my grandparents, that if we ever had a talk or a session from someone from, say, Surrey Fire and Rescue on home environment, the men would really like speaking to a fireman, and the women quite liked a man in uniform, if I'm honest. So what we've done is we've decided that we will record the firemen doing the exercises. So it's a bit of a partnership approach and a bit fun. But I think it's just, we're trying to think kind of outside the box, I suppose, on how we kind of engage people, but in a way that's just a bit more fun.
Nicola's example made my heart sing, the idea of tapping into a bit of fun. As we know, everyone is different, and the things that appeal to people are different. Happy memories here of my lovely mum, who's sadly no longer with us, using her four-wheel Batmobile, as she liked to call it, to transport her stash of wine and cake to her birthday celebration in her assisted living home. She lived in the apartment furthest from the action, and her regular walks up and down contributed to mum's physical and mental well-being. I learnt a lot from my mum. So what is this Whose Shoes thing, and why is it important? I've been a bit cryptic perhaps so far. Whose Shoes looks at issues from different perspectives. The crowdsourced scenarios that we use are all colour-coded. Formal power. If we wanted to make big changes, then these, the red people, are the ones that we'd need to influence. Then green, the community, businesses, volunteers, perhaps people who make PPE. Frontline staff, perhaps a doctor or hospital porter, and the blue shoes, all of us, the people, the patients, the concerned families and friends. So walking in the shoes of people struggling during the pandemic. And we use Twitter a lot. So as well as crowdsourcing the scenarios and poems from different perspectives, we get people from all perspectives to actually come together to discuss the issues, tap into their passions to co-produce workable solutions. It seems so long ago now that we held real workshops back in the room. Some of the most well-known work that we've done is around maternity care. And this is one of my other links with Brian Dolan, as the PJ Paralysis hashtag has obviously been phenomenally successful, but so has our MatEx hashtag, bringing people together to improve maternity experience. Here's a clip from one of our workshops last year in action.
Other babies are choosing to be dead.
when I think positive change can be made.
We have crowdsourced Who's Shoes resources for many different topics. So having given this little bit of background, I'll now focus on how the Who's Shoes approach can be applied in the field of MPJ paralysis, encouraging people to stay active. As with everything, it's all about what matters to them, and this is so individual. It's always such a pleasure to get people around the table talking to each other, and most importantly, listening and learning.
What, in hospital? What, says you can't reach the little table?
You might not have, so leaflets, newsletters. Yeah. So that last clip was taken quite a few years ago now, working with a home care provider who wanted to meet and listen to their clients. At the beginning of 2020, so coming right up to date now, I was thrilled to work with Fran Rawlings, a specialist physiotherapist, to plan a Who's Shoes workshop with people in Guildford and Waverley. They wanted to understand more about working with people to help them shape services around frailty and helping people to stay independent. I wasn't actually there. In fact, it was the day that we flew out to New Zealand, including meeting up with fantastic healthcare contacts and learning about their engagement work, particularly the wonderful maternity teams reaching out to the Indigenous communities. It was brilliant following Fran's event online. Twitter is so amazing for this. You can see people sitting around the Who's Shoes board game having their conversations, and in the background, Anna Gaia, one of the fantastic graphic artists that we work with so closely, recording the key points from the conversation in an engaging banner. You'll see more about how that works as we go on. Hopefully the scenarios spark a light bulb moment. Does this person really have so-called challenging behaviour, do you think? Peaceful pacing. We must do more to help our staff understand dementia. One resident keeps pacing in the home all day long, and the staff wanted to calm him down with antipsychotics. We found out he was a keen fell walker and used to walking miles every week. He was not agitated, just following his usual routine. We use poems too. What is this challenging behaviour? If my behaviour is challenging, I bet yours would be too. What would you say if someone came and stuck a needle into you? If someone you didn't know came and took you by the hand and tried to make you do things you couldn't understand? If my behaviour is challenging, ask yourself what you can do to make me feel secure and safe the way I used to do. So it was lovely, as I say, to see the tweets coming in from the workshop. Michelle tweeting here what was going on. And one of the very best things that can happen is if someone spontaneously jumps up and feels relaxed, able to share their experience. And I was absolutely delighted to see this happening in Surrey. So one of the participants who was living with dementia told people his story, and it was very moving. He, in his previous life, had been a public speaker, and he hadn't felt confident to stand up. He struggled to get his words together, but now here he was wanting to share that with the people in the room, and spontaneous applause and laughter. And I could feel how kind of inclusive that event was, and hopefully that made a lot of difference to that person, feeling that they'd managed to do that on the day. So it's difficult to kind of put a finger on exactly what happens at a Who's Shoes event, but passion, personal responsibility, we try and encourage people to make pledges, but only if they're from the heart, if they're real. And these pledges were starting to come through on Twitter. So James and Michelle, two senior managers in the organisation, were pledging to use the learning from the day to build it into everything they were doing, really. We will transform integrated health and care. We'll use everything we've discovered today to inform how we improve services for people living in Guildford and Waverley. And again, people in the room being inspired to make pledges. So someone here, and I'm delighted to hear that this is actually happening, some of the early outcomes that they're reporting from Guildford and Waverley, working with the hospital to transform the menu to make it have a carbohydrate count, to help people who are living with diabetes know what they're eating rather than just having to guess and hope that it fits in with their programme. And then the pandemic came. And ironically, this image of what felt to me like a Who's Shoes meltdown at the time, I took while I was on my holiday in New Zealand. So what were we going to do? And it was fascinating because Anna and Carrie, the graphic artists, were very fired up, and they said, do you think we can take our approach online? And interestingly, my husband, who's known on Twitter as Mr. Who's Shoes, became very excited about it too, because he's an IT man and he saw the scope to do some really creative coding, programming, use his proper skills rather than just helping me to bring something special to take the approach online. So unusually, I kind of got dragged along by other people a little bit, but not for very long, because I also saw the scope to link up and build these virtual conversations online, including my new links with the people in New Zealand and others through Twitter across the world. So we started to experiment, running a few test sessions. We were all way outside our comfort zone. A new topic, new content, linking up cameras and equipment, writing coding to try and bring the board game online. We were new to Zoom, we were new to MailChimp, Eventbrite, pretty much everything really. But it was clear that the pandemic itself needed to be the topic of the conversations. It was all people had capacity to think about. And we kept spotting really great things that were happening in different parts of the country, different topics, and it felt the right thing to do to kind of capture those and share them and have a positive focus to our events. So basically I was like a squirrel now, collecting best practice scenarios whenever I saw them and wanting to share them widely. And it was exciting because we started to realise that it wasn't just about the things that we were missing from our usual workshops, the cakes and the hugs and all the obvious things, but that we could actually do some extra things that were only possible online, like bringing in photos to illustrate the scenario we were talking about, this lovely little girl sewing her bonding squares, and to help tell the story as we went along. So as we went, the aim got more ambitious really, and a programme started to present itself, sharing best practice, but what about this group of people? What about that group of people? So we started to develop a programme of 6 sessions. What about the people who'd normally be having NHS services, not coronavirus related? What about black and ethnic minority communities who we were learning were sadly disproportionately affected by the pandemic? What about people who are just struggling? Could be any of us really, but perhaps people who are shielding, people who've got learning disabilities, people with mental health problems, people with dementia. And then we wanted to have a maternity special event, which was actually yesterday. And how does it feel to become new parents during a pandemic? What can maternity teams do to help? And then our final session, which is next week, building the future. What do we want to hold on to from this pandemic? Things that have happened more quickly, more spontaneously sometimes than we could ever have imagined, like virtual consultations, all sorts of things. So that's the programme that presented itself to us. So did you miss last week's session? Well, here's a taster of it if you did. We wanted to showcase best practice, particularly things that we want to see continuing after the crisis, but also bring people a bit of fun. So here's what we did. Let's throw the dice. So I think it's the yellow team's turn to go. They land on a green footprint and they pick up a green card. So this is just one of the scenarios that we used. Emily couldn't be on the call herself because she was actually running a couple of her sessions that afternoon, but it was lovely to have her explain in person what she was doing.
As soon as we went into lockdown, I was worried my brother Tom, who has Down syndrome, would become socially isolated. I wanted to find a way to help him stay connected with his friends, so I set up some online chat sessions. The groups have been very popular, and it has been very lovely to see the young people finding new skills and confidence. I'm now running similar sessions across the country, and I intend to continue them after the pandemic.
I love Emily's sessions because I go to my friends and it's really fun.
Emily's sessions have been amazing. They've really helped to get us through this lockdown experience, a real lifeline.
And we realised we had our own stories to tell. I loved the story so much from Carrie Lewis, our graphic illustrator, that we turned it into a Who Shoes poem.
Lockdown lifesaver. I was not known as someone who could leap out of bed. I'm plain grumpy first thing, it has to be said. Doing PE with Joe Wicks at 9 in the morning was definitely not for me, I told them yawning. But my mad sisters and their families were having fun on Zoom. I could see them all laughing, jumping round the room. Come on, Carrie. So finally on day 5, I joined my first session and finished barely alive. Every joint, every muscle was painful and sore. I thought, this is crazy, I'm not doing this anymore. But because everyone was doing it together, I kept showing up. It was only 30 minutes, I could go back to bed. But I felt alert, energised and motivated instead. We laughed, we moaned, there was real team spirit. I competed with my nephew, I was keen to win it. We flexed newfound muscles, we had banter and jibes, but all around we had healthy, positive vibes. I've gone from being lazy, old before my time, to proud of my waistline, feeling in my prime. Happier mentally and physically stronger. Perhaps the lockdown should last a bit longer.
And again, we got a great discussion going with everyone sharing their stories. This one is probably best passed over quickly. But one of the key aims of Who Shoes is to spark what we call lemon light bulb moments. As you will have seen from Fran's workshop, we invite people to make pledges from the heart, things they've been inspired to do as a result of the conversations and connections. We've got better at doing this online now. Here are some of the pledges from last week's session. Our 2 key themes were music and physical activity, and we have pledges related to both. As the creator of Who Shoes, I love connecting with people and helping them connect with others across any imagined boundaries. We're all people. We have so many stories, but one of them concerns 2 wonderful music therapists, Grace and Claire, and how we all crowdsourced a production of Matex the Musical on the main stage of NHS Expo, the biggest healthcare conference in the UK. But that's another story. Anyway, last week Grace and Claire joined our virtual session, so it was inevitable that we got them to lead a bit of Who Shoes magic.
Yeah, we did it! Right, so last little bit then. Last little bit, let's get those instruments going. So we can just have a simple, so do what you want, but we can have a simple beat, so. So, should we try and put it all together? And I know that some of you can't sing because you're in a shared office, so maybe you can mouth along, or
well,
you might
you could just sing in the shared office.
Yeah, or tap along. We have a go. Maybe we could speed it up a bit, because I was thinking about the different paces that we all walk at and work at and talk at. So
and sing at. Yeah.
And sing at. Yeah. That's great. Whoever's got that going, that's fantastic. So give us a 4 in, and then let's have a go. So 1, 2, 3, 4. Whose shoes are you walking in? 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 If that's what you had in mind, but that's what's happened.
Brilliant, great. Very
idea what we've got in mind. We've never got anything specific in mind, just that a little bit of magic can happen. So well, it was brilliant. But the extra magic came from Trevor, who spontaneously led a bit of exercise snacking. B for brilliant.
I like the term exercise snacking, and I think I have got an exercise snack which is musical as well. I've been doing Gareth Malone's virtual choir, and one of his warm-ups, I think everybody will know, My Bonnie Lies Over the Ocean, My Bonnie Lies Over the Sea. But one of the warm-ups is every time you sing that, but every time you say a word that starts with B, you either stand up or sit down.
Can you lead us, Trevor?
Serious exercise snacking. We'll just do it once.
Okay.
My Bonnie lies over the ocean. My Bonnie lies over the sea. My Bonnie lies over the ocean. Bring back my Bonnie to me. Bring back my Bonnie to me. Bring back my Bonnie to me.
Bonkers.
It was brilliant with a buff. And very good fun. I can't get over the talent of Anna and Carrie and the way they capture the conversations. They do these live during the sessions, and we've found it's just the same experience online. Something new that we've been experimenting with is also doing a reflective piece, a learning synthesis from each event. You can look on New Possibilities website to view these in detail. Here's the graphic record of last Friday's event. Well, I did promise Brian Dolan I'd try and make this presentation topical. So thank you for listening. I'd love to connect, but realistically you can best find me on Twitter, @Who'sShoes. I'm excited about the possibilities of virtual Who's Shoes to link with people who want to make a difference and continue the conversations across the world. Hello, my name is...
So that was the film we made from our 4th session, and it obviously had a big impact because after Claire Flower, music therapist from Chelsea and Westminster Hospital, led that singing with her wooden spoon and cheese grater, they were completely sold out in the shops. So what were we going to do after that? So session 5, I was looking forward to just a little bit more within my comfort zone in terms of Matex was just been such an incredible community, and we knew we could go bigger. We knew that if we wanted to get a lot more places and people on the call, that we could do that. And as I say, we were experimenting from week to week. So we were trying out, well, how would a big virtual session work? Could we manage it? Could we build in breakout rooms? How could we keep it engaging? So that was the Matex special. And again, in terms of the bits I've picked out from it, we had quite a few different scenarios, as you've got the idea by now, but I've picked out one here, community scenarios. It is not great having a baby during a pandemic. Every new mum, I've got 3 children, you want to show off your new baby. You want to see your parents, your family, your friends. You want people passing in the street to coo over the baby. So we've done a lot of work around perinatal mental health. And through our work, we've met up with Lorraine, who's in Gloucestershire, who runs these incredible Shine sessions. So this was pre-COVID, but again, she's managed to keep these going online during the pandemic and keeps in touch with us, telling us what they're doing. So Shine on New Mums. At Shine, we've been running Zoom workshops for our Shine mums whose courses were cut short by the pandemic, keeping the creativity and the peer support going as best we can. Maternal mental health is still there, more overwhelming than ever. And we're still here helping people connect and relax together. So it's not all about NHS solutions, as we've said strongly. It's about communities helping themselves and each other. So another example, now this one is an NHS example. A friend of mine working in a hospital was, no, sorry, it's a different example. We had a different scenario around a chief executive making films to inform his staff every day what was happening, really get fantastic communication going within a hospital and build trust. Sorry, I thought for a minute it was that one. This is our maternity team is working closely with our local Maternity Voices partnership to listen to the concerns of women who are expecting a baby at this difficult time and find out how we can best reassure them. We're making regular videos to explain how things are currently working and to address specific concerns. For example, I made a video of how I put on my PPE and people said it helped them to see that it was still the same person smiling and caring inside the face mask and the eye protectors. So this example came from Cornwall Maternity Hospital. We work with them very closely. They've done a big annual Who's Shoes event for the last 4 or 5 years, picking out a different topic and really doing it well in terms of planning with their local community, co-producing what they want to do, running a great event and then following it up. So Sarah Jane Pedler, who's the professional midwifery advocate in Cornwall, sent me this. And again, these things you could look up if you're interested and see on YouTube. They've made films about just all sorts of different ways of being in touch with women, running antenatal classes, showing, in this case, a professional putting on PPE so that it's not so scary. So another one here. Now I love this one. I think there's a picture that goes with this one. As a midwife, I think this was my favourite consultation ever. At a mother's request, we had a consultation in the park. Conversation just flows and everyone feels at ease. Now I love that. And we had such a, we were lucky, weren't we? We had good weather in the summer. Why would you struggle to have something indoors if the same objectives can be achieved outdoors and more fun and safer and more human? So these were the kind of examples that we were collecting from the community, from the NHS, from social care, building into our scenarios and getting people talking about them and seeing whether they could do the same thing, or people become proud of their examples. So they say, well, actually what we're doing in another part of the country is such and such. And that's how the kind of good practice spreads. So we tried to, you've seen us build music into our sessions. We were very keen to kind of practice what we preach in terms of self-care. You've seen how during that last video clip, we built in a bit of exercise snacking because we were talking about MPJ paralysis. So we had people jumping up and down to My Bunny Lies Over the Ocean, spontaneously started by my neighbour, which was brilliant. And in the maternity workshops, we found out there's a lovely clip that you may have seen. It's absolutely beautiful singing, Over the Rainbow, put together by the NHS midwifery ambassadors. And we included that as a clip during our session so that people could just relax, get a cup of tea and watch and absorb the music. But it was lovely for me because I kept seeing people that we've worked with over the years through our maternity workshops. So that clip there just happens to have Dawn Morale in the bottom row there, smiling away. And these are just such lovely people to work with. And Sarah Jane Pedler, the PMA that I mentioned earlier, professional midwifery advocate, that's right, has put together some relaxation videos. So again, as a really practical way of helping mums at home struggling during the pandemic. So we were trying to end our sessions with something relaxing. People that spend too long on Zoom. So to have either somebody leading ideally a live session or to be able to show a little video clip like that was really important, we felt. So again, one of the wonderful learning synthesis images that were put together following the event, and all of these images are available for you to see in more detail if you're interested. So that brought us to the final session, session 6. And we were punching way above our weight, really, in terms of 2 very small businesses trying to make a difference. And we called our final session Building the Future. And we weren't sure how it was going to end. And it ended up being pretty much a community takeover of some fantastic people coming on live and telling us what needed to happen. So that it was very exciting, but the kind of scenarios that we built in to make people think. Now, again, when scenarios, they just come from people. They came from our team, they came from our families, they came from just anybody you spoke to, really, with different experiences. So the NHS speak would be remote monitoring, but this is it translated into what it meant for one of our participants' mothers. Clever gadget. Since having my pacemaker fitted a couple of years ago, I've had to go to hospital every few months to make sure it works correctly and to check on my heart. When the pandemic came, I was sent a simple device whereby the hospital can monitor this information remotely. I used to find the hospital visits difficult and stressful. This is so much better. So obviously, again, discussions around that, the stress of going to hospital, the worry about catching COVID, but just ordinary things like car parking and, fitting it in with day jobs and families and so on. So how do we make these fantastic spontaneous innovations stick after the pandemic? So I think we've got we've got poems coming up now, I think. So this is in terms of the kind of like whistle-stop tour of the sessions we did. As you can see, we've used poems quite powerfully and to get people thinking about different perspectives. So lockdown lessons, I think this is a poem read by a young couple in terms of the humanity of the experience and taking everybody with us. So see what you think about this one.
Lockdown lessons. I'm trying hard to accept the situation, our loss of freedom, and all the things I'm missing, and appreciate the here and now. Time to have time, to grow and to learn. To realise it is not a crime, to be rather than always to do. A new me and a new you. A time with permission to stop and not constantly shop. Not constantly take the kids here and there rushing, our spirit crushing. As the demands of each day come in relentless waves. To be where we are and notice the stars. Appreciate less pollution. Wonder what the solution will be. What our new normal will be. What we can leave behind to which we were blind. Get to know the kids and the parents. Worry a bit less about our appearance. Watch the trees start to bud. Appreciate the blossom. Nature continues regardless, the way it's always been. Oblivious of COVID-19. Watching the birds in the sky. And realising, finally, that the best things are not always what money can buy.
So I think that goes into another poem, Building the Future. And Building the Future is a technical hitch, apparently. Here we are. So Building the Future, this is the part that we're all kind of building up for. What can we do to hang on to the good stuff, make it stick, and not go back to over bureaucracy, too much stuff, too many people waiting to ask permission from other people, and just being able to work together as human beings.
Building the future. A global pandemic. There is no question we were scared. But with fantastic team working, we came together because we cared.
In some ways it was refreshing, a weird kind of blessing. We were able to be bold, to ditch things that left us cold.
Targets for the sake of targets, counting for the sake of beans, filling endless paperwork like soulless machines.
But rapidly changing guidelines, new procedures every day. We tackled huge challenges and always found a way.
We surprised ourselves, responsive and reactive, sharing and learning, a rare chance to be proactive. Our clinical skills recognised, self-motivated, energised. What is best for this patient, this situation, now?
Do you need to take a break? Listening with compassion, feeling valued and cared for, staff and patients, everyone.
How did it happen we were so remiss that it took a pandemic to appreciate this?
The stifling bureaucracy has lifted, the power has shifted, and if there's one thing we know, We must never let this go.
So again, the key images from the workshop, I thought this was absolutely extraordinary. Carrie Lewis managed to use some of the backdrops from the earlier session, greyed out in the back, and this fantastic tree. Can we zoom in on that? And go down to the roots and just show how it. Just think it's worth taking a minute or two to appreciate that, because it's got so much content in it and so much learning, really. How do we make the most of these images? We've ended up now with 12 images from our sessions, the live records of the conversations themselves, absolutely packed with learning, and then these learning synthesis images after the event. But I couldn't be more proud of our graphic illustrators who've put this together so quickly. So virtual Who's Shoes, I guess the big question, what did it achieve? So as you can see, I've done a very academic, in-depth analysis of what we achieved, and it was all sorts, really. It was things that we anticipated, things that we hoped would happen, things that we had no idea would happen. I think it's probably been the biggest learning curve of my life, literally. And friendships, I've worked with Anna and Carrie for probably in total getting on for 20 years in terms of in my original day job, and then more recently with Who's Shoes. But it's when you actually do something really big with other people and you rely on each other as a team. And I think some of these key messages are, that was my particular story, but it will be true of all of us in terms of taking on something difficult and working at it to make it happen together. And there's absolutely no way that you could do it on your own. And my technical skills are pretty rubbish, but Colin, my husband, came to the fore and was able to bring his skills to that. And Colin, tell us just a second, he's lurking here in the background. He's going to, what kind of technical expertise did it take to develop the online sessions?
Was basically trying to bring a database of scenario cards and poems which held in a Microsoft Access database, and then being able to show those on a screen, which is actually a virtual web camera that was all enabled by a piece of free software called online broadcasting software, OBS for short. And that enabled us to do a lot of combining of the scenarios, the poems, bringing pictures, bringing in videos, and all show them as one to the participant screen within a Zoom session. So it was quite a lot of work to actually pull it all together, and we're constantly improving on it all the time.
Trying to, yeah. Okay, thanks. And other things, wasn't it? And quite a lot of other aspects.
And all the other aspects of making that happen, which was, I think Jill mentioned earlier, was getting our heads around Eventbrite, MailChimp, SurveyMonkey, and getting and some of those are quite tricky at times. So it was a very steep learning curve during the summer when we were doing these 6 sessions.
And obviously just really practically a way of keeping our business going. Our business really relies on people coming together, and they weren't able to come together, not physically, and to be able to carry on the conversations that we believe are so essential in terms of engaging with people. It's been very interesting in terms of, I think, increased accessibility for some people. Certainly if we have a workshop in the middle of a rural county and want mums to come, whether you've ever tried to put a young baby in the car and get all the stuff ready for them and then park at a hospital and perhaps add in, 3/4 of an hour journey either way, then that might be a lot more accessible to that person. But it would depend whether they've got a broadband connection. It would depend on all sorts of things. So I think the whole business of how to take forward best practice after the pandemic and involve everybody and not leave people behind, these conversations are so important. But in terms of a more formal account. We did actually manage to do a report. This isn't our report. I'll come on to our report in a minute, but I'm going to play a clip that literally comes from Monday. So we try and keep things topical. I took part in, I ran a CoPro live session on Monday as part of the launch of the UCL Centre for Co-Production, which is tomorrow. They've got their launch event, so you might like to join that. And as part of that, Professor Becky Morby, joined our website. Now, I work closely with Becky and have done for years through the Darcy Fellows programme, which I'm really proud of. I'm a regular contributor to their co-production module using Who's Shoes. So Becky joined the event on Monday, and there was a lovely little clip that I've asked her for permission to use today, and we'll play it now. While we were in the middle of doing our Learning from COVID series, Becky and her team at London South Bank University published this, I thought, extraordinary report, because it's brief and it's visual, and it seems to just capture what needs to happen. So I don't know if you'd like to say a word or two about that, Becky.
I think the bit that sort of really struck me in this was not just that, it was mostly that the NHS, when it was working well, was mirroring all the conditions that you see in high-performing health systems around the world, from Jönköping to Birstall to Intermountain to Nuka. A lot of these conditions that we saw in this big picture were things that are just how we do business around here. And I suppose the sad thing is how quickly we've gone back to not doing any of those things again. And two of them that are relevant to this was one, real shared power with citizens around making decisions. So people coming to the, particularly in primary care, coming into the consultation, I guess with having a stronger sense of what they wanted, having more diagnostic tools that they were using directly, but also for primary care being able to see into people's homes, talk to people's carers, see their context, meant it just shifted the power base. And also the use of WhatsApp with doctors was really quick, so people were getting things done without loads of appointments, where it was working well. But the other thing was that the NHS stepping out of the way and asking for help, and staff feeling properly valued by the community, again something that's been completely lost in, as we've gone into this phase. Certainly our clinicians don't feel this anymore, but did at the time, and they felt that they were both valued, and that meant that they actually found it easier to ask for help. So I think there's something very interesting about this dynamic. It's not just the NHS needs to step out of the way, it needs to feel like the community wants it to step out. I don't know if that makes sense. It's a sort of it's a two-way thing. And so where the NHS asked for help, of course, citizen community stepped right in and did fantastic and amazing things. And that a clinician, certainly the general practitioner's role, was then to be a sort of upstanding pillar of the community, i.e. to be very present in the wider community discussions, and also to turn up to communities and say thank you, and to listen. And I suppose the third thing that struck me here was, the voices of silence, that people who hadn't been heard for a very long time were beginning to be heard. Again, I feel like of all those conditions, the one about staff health and well-being, some of those things are sticking. Some of the relationships within the health system is sticking, but the relationships with citizens, some of that is really not sticking, and that worries me.
Yeah, it's interesting looking back, isn't it? The kind of excitement at the time in terms of the potential, and then, like you say, to see things slipping back. I mean, certainly from your network, Becky, I'm just so grateful in terms of people like Fazana and Jane Dawes and different people within the primary care world very much contributed to our scenarios in terms of just sensible but innovative, just do it type things, like having outdoor drive-through clinics for inoculations, midwives having a consultation in the park, because that felt, it was in the height of summer, a way of seeing someone and chatting through perhaps some practical issues that didn't require a consulting room, but so much more personal than necessarily a virtual consultation. So, and then you see some of the scenarios that we actually use, like wobble rooms actually being closed, and that's such a physical thing, that some of these things might be more subtle, that people feel less supported, but you either have a well-being room or you don't, and on the day it closes, that must feel pretty rubbish, I think. So we did our little bit and actually wrote up our report, and the image in the middle was me trying to, this is from Becky's. Report, the big picture, see how our scenarios that we'd used, scenarios and poems, I think the scenarios were in yellow and the poems were in orange, just a real kind of JFDI from the top of my head, thinking, have we got something around that, have we got something around that? And it was quite an interesting exercise. So I'm pleased that today, because I really haven't got round to doing a very sensible website over the last 6 years, because we're just too busy doing other stuff, that we're kind of cuckoos in a way. So our report from the work we did over the summer that I've been talking about has just been published on the Fab Change Day website. So while we were in the middle of doing our learning, it just shows that having praised up Mr. Hooshoes and his technical skills, we'll probably have a domestic now because that didn't go so well. So is this still part of the video?
No.
No, okay, so we're back to the slides now. You're sort of trying to do something quite, obviously you've only got so much time to put into these things, building clips and slides and presentations and so on. So this was from the end of our report. This was some quotes that came from the session. And I just wanted to try and zoom in on a couple of these. So in terms of some of the outcomes that have come from the series, this is someone called Bernice, who has, these are all fantastic people, either in the community or in the NHS or wherever. We attract fantastic people to who want to make a difference. And Bernice has set up, she's the co-founder of the award-winning Wave for Change. Wave for Change is a very successful community whereby people with learning disabilities socialise with people without learning disabilities. They socialise as equals. And as part of one of the connections through, is actually through Claire Flower, the music therapist, who's introduced us to Wave for Change. And we're looking to do hopefully some Hooshoes work with them, helping them spread some of that philosophy further afield, so that everybody can benefit from that kind of just normality, really. We've heard from Steph today from Patient Safety Learning Hub, a couple of really nice quotes there. Helen Hughes, who's Chief Exec of the Patient Safety Learning Hub. Claire Cox, who was one of our lovely Darcy Fellows, she's the one that's linked me into patient safety learning. So I'm just mentioning this in terms of how informal networks work and how you can connect with people. Claire, a lovely quote there, patient leaders and clinicians in a room talking together with no hierarchy. It was useful for networking, collaborating. And that was interesting because Claire had actually attended Hooshoes workshops in the room, and for her particular role in patient safety, she actually got more out of the virtual sessions and the wider networking, possibly than she did from the in the room sessions. So it was quite rewarding and quite sort of like affirming, really, in terms of what we were trying to do. I absolutely love this quote at the bottom. I couldn't recommend to you any more highly Benash Nazmeen, who's a midwife up in Bolton. I think she's the only specialist cultural liaison midwife in the country, and doing amazing work around improving things for people from all sorts of different ethnic groups. And she helped us very actively to develop our session, as I said. Thank you for taking the time to reach out and develop such a vital workshop, highlighting a subject that often makes people awkward and uncomfortable discussing. We need to overcome this awkwardness and discomfort to truly be able to address these concerns and inequities. So that was our report. It's an 8-page report. It's available now on the Fab Change Day website, and this is a quote from it. We wanted our sessions to contribute to building the future of health and social care and harnessing the power of people who'd spontaneously volunteered to help and indeed lead in so many ways. So let's work together. You heard Shahid from Princess Alexandra Hospital read our Let's Work Together poem early on. This little image here, which we could perhaps close in on, on the right was taken from the final Building Our Future session. So some absolutely kind of key messages: having a common purpose, smashing the rules, a belief in humanity, speaking out when this is not right, and taking the opportunity to hear the voice of all people. So I think I wasn't sure quite how the time was going to go. I think I've just got time to tell you a couple of short little stories. So in terms of probably the biggest outcome, the biggest single outcome from Whose Shoes, I'd say is in Liverpool, because, and just the way the story involving no hierarchy, just people, and the power of anybody to be a leader without having it, you know, in a formal position of power or in your job description necessarily. So just briefly, Helen Calvert, who's in the middle of that photo, top left, is a mum in Liverpool who had a baby with a very serious heart condition, and he needed open heart surgery. And Joanne Minford on the right is the consultant paediatrician at Alderhay Children's Hospital, who looked after David and operated on David, and an incredible relationship forms. And Helen also is one of the sort of founder mums in our Matex community, an absolutely just do it woman. She's the one who, without asking anyone's permission, set up the Matex Facebook group, which has now got over 4,000 members. And she was absolutely determined to bring Whose Shoes to her local hospital in Manchester, which she did. We had a really good workshop there. But probably even closer to her heart, if you like, was bringing Whose Shoes and the whole kind of approach and the ethos to Alderhay Children's Hospital. So luckily we got people who were listening there. So Joanne Minford, consultant paediatrician, going way beyond her job role at the time, getting hold of Whose Shoes, wanting to pull people together, wanting to have conversations. And in the middle of the bottom left photo, Louise Shepherd, the chief executive there, fully supporting her. And that's the kind of mix that you need to make things happen. And fast forward, and Joanne's saying that Whose Shoes was a key part of getting a business case approved to build a new neonatal unit in Liverpool. And in the picture on the left there, you've got, this is Joanne's tweet: neonatology and PQ consultants having a clinical conflab yesterday. Previously, they never saw each other. Now, in terms of breaking down silos, getting two hospitals to work together and getting co-production conversations leading directly to a new neonatal unit, that's a pretty big outcome. And I think there's probably just time to show you, I've mentioned in passing as we've gone along, extraordinary things that can happen in co-production. And probably personally for me, the most fun and the most stress equally came from, and I don't know if any of you saw this, but 3 years ago on the main stage of NHS Expo, Matex, the musical, it's an absolutely crazy, incredible story as to how it happened, whether it was meant to happen, but we ended up with people, there were over 30 people, real people from real different aspects of life, so colour-coded with their Matex sashes, from Julia Cumbledge, Baroness Cumbledge, Jackie Dunkley-Bent, National Chief Midwifery Officer, Sarah Jane Marsh, who was leading the transformation programme. They were amongst the red people, the formal power people. We had parents, we had bereaved parents, we had GPs, we had clinicians, obstetricians, midwives, we had a student midwife, we had all sorts of people coming together as equals and bringing the better birth story alive through music and through Whose Shoes scenarios and poems. And there's just a very short clip of what this actually looked like on stage. So let's help women have a voice, a safe birth experience of her choice. And I think that co-production, that just ability to bring people together and tap into their strengths. So we just said to the music therapist, we need a piano. We need a piano on the main stage of Expo. Can you get us one? And they crowdsourced a piano from Forsyth's Music Shop in 150-year-old music shop in Manchester. And they said, well, we'll give you a better one because it's got our logo big on the back of it. So you can do things without a big budget. You can do things informally if you tap into other people and believe in them. So I think that's just about the end. I've got this little poem. I don't know if you might enjoy this. Wrote it a couple of weeks ago, and it was just like one of those days. And I thought today is going to be one of those days with all these fantastic NHS change sessions going back to back. So, virtually challenged, what am I doing today? I check my diary in anticipation. Yep, it's all online. No rushing to the station. First a webinar on WebEx, and then a couple of Teams, and then a FaceTime and a WhatsApp. These meetings fill my dreams. An in-event conference, nipping from room to room, and then to wind down in the evening, we'll have a family Zoom. So it feels a bit bizarre today. I'm used to sort of having lots of people with cameras on and lots of interaction and all sorts of things. But I hope you're all out there, and I hope you've enjoyed our presentation and got something from it. Thank you very much. And any questions, I'll be happy to take. There's a few minutes left.
Thank you very much, Gill. That was absolutely wonderful and amazingly creative to hear all the things that you're doing at Whose Shoes. As Gill said, if you have any questions, now is a good time to write it in the chat box, and Gill will be able to answer those for you before we have to end the session. So I'll give anyone a couple of minutes to write that, and then if not, we'll close it down. In the meantime, there's some lovely messages on there for you to read, Gill, if you haven't read them throughout. And also
to read the messages
from there. So yeah, make sure you get the links from Steph before you leave the Zoom as well, for those people that want to follow those links up on the websites.
Okay, no, that would be great. And thanks so much for inviting me. I've enjoyed it, and I just hope it helps in some way with the conversation, because that's what matters, isn't it?
Absolutely. Wonderful. We haven't had any questions come through yet. So
Everybody's zoomed out. They've taken the poem. They ought to take
your amazing creativity
tea before the next one.
Amazing. Shall we leave it there then?
Brilliant. Thank you.
Thank you so much.
Thanks. Bye.